Cryo T Shock is an extraordinary innovation for a successful approach in anti-aging, skin rejuvenation, fat loss, and cellulite reduction. Stage 1 uses the application of heat that causes vasodilation. This relaxes the tissue. Stage 2, an extended period of cold is then applied to the same cells. The sudden cold after warming has a more dramatic effect on the cells than if heat or cold are applied alone. Exposure to cooling causes the fat cells to adipose, a natural controlled cell death which leads to the release of cytokinesis and other inflammatory mediators that gradually eliminate the affected cells. Below freezing temperatures trigger the fluid that binds the fat cells together to crystallize. This crystallization destroys both the cells and the bonds holding the fat cells together. The T Shock is the only device which has the capacity and adequate Peltier cell wattage to deliver a rapid and dynamic exchange between hot and cold. The prolonged period of cold permeates below the dermal layer to cause fat cell adiposis. The fat cells die between 12 to 17 Celsius. At this temperature, only the fat cells are affected. Beneficial cells remain unharmed. We then apply the warmth to the treated area, which relaxes the dead fat cells and induces them to release their lipids. This release causes a contraction of the fat cells, preventing them from aggregating in a frozen mass. The inflammatory cells gradually digest the affected fat cells in the months after the procedure, reducing the thickness of the fat layer. Lipids from the fat cells are slowly released and transported by the lymphatic system to be processed and eliminated. With a proper lymphatic drainage through exercise, 90% of these fat cells are excreted through the lymphatic system over the next 2 weeks. The entire process for each treatment takes 1 to 2 months. And those are the 4 stages of your thermal shock treatment.